Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified internal medicine, rheumatology, and obesity medicine specialist. Today, I will talk to you about a topic that I essentially see in all my patients who are dealing with either autoimmune disease related inflammation or obesity related inflammation, and that is high levels of homocysteine. Homocysteine is a blood biomarker for indication of elevated levels of homocysteine in the blood, which are associated with higher risk of heart attacks and stroke. So, on this YouTube channel, I would be talking to you about autoimmunity, inflammation, obesity, and how to live a youthful life for longevity and vitality. If you like this video, please subscribe to my channel and share it with someone that you think might benefit from it. So let's talk a little bit about a crucial relationship between homocysteine levels and metabolic disorder or metabolic syndrome. It is important to understand this topic because methylation process is the reason why we get a decrease in the methylation associated with obesity and why homocysteine levels go up. So methylation is a biochemical process where a methyl group, a carbon atom bonded to three hydrogen atoms, is added to the double-stranded DNA and other molecules. This is a process that's happening in our body to help our body reduce the chances of aging and other damage to our DNA. This process is crucial for the DNA repair, for the gene expression, and for detoxification. I studied as a University of Michigan fellow that the demethylation process um, um, was methylation process was compromised in patients with lupus, and that's why we had more diseases in patients with lupus. The same I am seeing with obesity now. The process of methylation is regulates our genes, how our genes behave, which means it's essential for our overall health, our disease prevention, longevity, and vitality. So, how does obesity comes into play with homocysteine levels? Obesity, especially when associated with a BMI of more than 30 or higher, it can impair the methylation process. Studies have shown that individuals with high level of obesity have decreased altered DNA methylation pattern, which are linked to metabolic diseases such as type 2 diabetes, cardiovascular diseases, and even certain cancers. Essentially, excess fat can disrupt the body's normal methylation process, leading to inflammation and metabolic dysfunction. This brings us to the next question. Why do patients with obesity often have elevated levels of homocysteine? This is in the blood biomarker panel that I check for my patients when they come to me for the initial consultation. Homocysteine is a test that your doctors can also order for you. Homocysteine is an amino acid that, when in excess, can damage the blood vessels and contribute to heart disease, leading to impaired conversion of homocysteine into methionine. This results in elevated homocysteine levels, which increases the risk of cardiovascular disease, stroke, and other complications. So, whenever I see these patients, I tell them, look, you're on the journey to helping yourself. I am there with you to help you each of the way. And we will reverse your metabolic disease, will reverse your insulin elevation levels, your C reactive protein, and your homocysteine level would become normal. Optimization of diet and nutrition like folate, L-methylfolate supplementation, about 15 milligrams a day. I usually recommend all my patients. B6 vitamin, B12 vitamins, they can help restore proper methylation. These nutrients are essential cofactors for the enzymes that drive the methylation cycle and reduce the homocysteine level. So, in summary, obesity disrupts the body's normal methylation process, leading to elevated homocysteine levels, which in turn increases the risk of cardiovascular disease, metabolic diseases, and stroke. If you or someone you know struggling with obesity and they need a motivation, I would say ask them to get their doctors to check homocysteine level, and they would understand the methylation process disruption happening and the risk of cardiovascular disease. You can also check high sensitivity C reactive protein, and I'll make another video at another time for that topic as well. Thank you for watching, and if you found this helpful, subscribe to my channel and take care of your health and your diet and your loved ones. Until next time, see you again.